chemistry, biology.
How do people contact you?
You can contact me on through my email, rkamma, RKAMMA, at yahoo.com. You can text me at 352-327-8850.
Awesome. And now, Dr. Kamma, talk to us. When it comes to our youth, as you know, spring break has been extended an additional 5 days. So if a child is on medicine, this is my first question, should that child take their medicine even though they're not going to school?
In the situation where we have kids, they're being home, and some parents, they feel like since they're not going to school, they don't need to take their medicine. And the best interest for all parties involved, whether it's the mom or the dad or both parents and the child, the best thing to do is to remain consistent, as if at all possible, as just as if they had to go to school on a regular basis. Just keep the consistency, because what happens is you throw the child off their schedule, and once they're off that schedule, then it takes a while to get them back on the schedule. So the main thing is, while we're going through these times with the pandemic, with the coronavirus, if they're on any type of medication that they normally take on a regular basis, continue to take their medication in that fashion.
Yeah, because I know that there's some teachers out there who said that if the parent won't give the child the medication, then give the teacher the medication and let them take it. But like I said, rituals and routines are huge. So thank you for reinforcing that, because you want to keep them on schedule. If they do have a written diagnosis or some type of prescription, that they stay to that particular prescription. But at the same time, shifting into this particular virus, do old school remedies still work?
Well,
give me that fat back and that penny.
Now, old school remedies will always work. The old school way will always work. The whole thing of the situation right now is, will it be effective for what we're dealing with? And we have a lot of viruses, we have a lot of bacteria, we have a lot of what we don't want to call them germs, but that's what we lump those two things into. We lump them into a category of germs. Now, there's really no such thing as germs, but we do have bacteria and we do have viruses. Both of those things, we really have to change some of our bad habits and make those new habits consistent, such as the washing of hands. And I want to get into that later, but but as far as the coronavirus is concerned, and viruses in general, it's important that we get ahead of what's in front of us. And it's the number one thing that we can always do is prevent. Once you're trying to treat something, once you're trying to cure something, once you're trying to rehab, give therapy, then you're behind the ball. Mm-hmm. The number one thing is to not get it in the first place. Right. So the old school thing, the old school adage is an ounce of ounce of prevention is worth a pound of cure. Oh. So if we can always keep that in mind as we move forward, not just medically, because everybody looks at it as a medical thing. It becomes a medical thing once you have it. But if you just look at it as an act of hygiene, an act of goodwill for yourself and for your fellow man, then I think everything we won't have to endure that peak that we're looking at the graphs that President Obama and some of the CDC has put up, in the World Health Organization.
You mean Trump? But you said Obama.
No.
Obama said it too?
I'm going to tell you what happened.
Oh,
because Trump hasn't given us much of anything. Just to be factual, and that's hard to do in a world of anti-facts. But Lil Duval actually I'm serious. He was actually on the Instagram, and he asked for help. But Obama did send out a short reply showing the graph of how most viruses work, and how if we get ahead of it, we won't have to endure that, what we call a critical mass, right. A crisis. He did give us an actual graph that shows us how to prevent moving into that era.
Okay. And now, so another thing, before we bring on Ms. Tyrica, the owner of Posh Naturals, I want to ask you this: medicine cabinet or vitamin cabinet? In this type of situation, what are we going to do? We got some juices and berries.
Namaste. I'm going to say this because we have to deal with our populations. We have to deal with our populations. One of the populations that we have to deal with is our
Hold on a second. This is to the ancestors, the old and the new.
The old and the new. You do realize we may be the new ones.
Keep going now.
Okay, but our elderly population, just like the children. You asked me about the children. Should they take the medicine? Should they not take the medicine since they're not in school? But the medication is not for school. The medication is for their actual behavior.
Right.
Because that's why you took them in the first place. But with the elderly, take your medication as prescribed. Continue. Don't stop taking your. If you take your atenolol, keep taking your blood pressure medication. You taking your glucophage, keep taking your diabetic medication. This is very important. But the elderly are going to be the most affected by viruses and by bacteria. But in this situation, it's a virus. The coronavirus is very, very easily transmittable from person to person.
Yeah, and now please, because we talked over the phone, and one thing that you said that really heightened my awareness was, I was told that if you had a cold, that after 3 days, the part that made you sick had already left your body, and that all you're dealing with is the symptoms. But you said pertaining to the coronavirus, that's not true.
That's not true.
And what was the difference between the two that you were bringing to my attention?
Because the virus is highly, it's easy for you to catch because it's that type of a virus. Now, this is not your mom and dad's virus. This is not their virus, where you could just, stay in the bed a couple of days. No. This could easily trigger and move towards death. It could easily happen. But I want to assuage some of the thinking that's out there that, hey, the world is ending. The world is not ending.
The world is not ending. You're going to be sick if you don't take care of yourself.
You will be sick if you don't prepare. And most of us are not preparing. Most of us, and when I say prepare, we have people going out buying buckets of milk. I mean, just boatloads of milk, buying toilet tissue. I'm like, why are we buying these things? Right. The number one defense is soap. If you're going to clear the shelf of anything, you should be clearing the shelf of soap, of Lysol, of Clorox, because these are things that actually work. But my question is this, since we were talking about old school things, my question is this, when did we stop doing that? When I was growing up, you couldn't walk down the hall and rub your hands along the wall in your house, let alone the hospital where superbugs are. You just couldn't do that. And if you came to the dinner table and your hands were unwashed, mom was like, hey, what are you doing? You had to be like, boy, if you don't get up and go back to that bathroom and clean them hands. So hand washing has become almost obsolete, a figment of our imagination. What's hand washing? You mean we actually have to teach this again? And that's what we have been doing as healthcare providers. We want to get that message out there, that hand washing, simple hand washing. And there is something that you do need to take into having your understanding. I do understand the Purell. I understand the hand sanitizers. They are alcohol-based. But they are not, and we should use them. Don't get me wrong. Anywhere where we do not have soap, we should use them. Soap is the number one defense. That's the number one defense.
Now, if we're going to pause for just a second and transition, Ms. Tyrica, if you would please introduce yourself to the listening audience, the viewing audience. Tell them where we're at, and then talk to us about some of these solutions and what you discovered throughout this period and how what you serve can help us on this journey.
Absolutely. I am Tyrica Nelson, and I'm the owner and founder of Posh Naturals. We're located at 1818 North Davis Street, right across the street from McDonald's, near Walgreens, and the building that will actually say A Street Cafe. And what we do is we provide individuals with the information that you need. We guide, we counsel in regards to going towards a natural state of being. So we're here to help you come back to your natural state of being through herbal teas and through healthier food options, particularly vegan foods. And we have non-vegan things here, but we really try to educate people and give them the opportunity to try veganism if you hadn't tried it before, because a lot of people would think it's bland, it's nasty, but we make the food taste the way that you would enjoy it.
Now tell us about this right here. What is this?
All right, so what I've given you guys today and
To
what
the ancestors.
everyone can receive, if you come into Posh Naturals, you will receive a small cup of our what we call covered 19 tea. So this is a herbal tea. And this herbal tea has about 6 to 7 different herbs in it, natural herbs that are sourced from Jamaica. And with the herbs in it, it helps to boost the immune system. It breaks down mucus in the body. It kills viral infections. It kills bacteria in the body. It also helps with any type of inflammation in the body with burdock root, elderberry, mullein breaks down mucus out of the lungs and helps to strengthen helps to strengthen the lungs. And sage helps to break down mucus from the ears, the nose, and the throat. So all of these areas are some pinpoints in regards to the virus and how it could be affected, how it could affect the body. So we've done some studies between Posh Duo and I have done some studies to see what herbs will be more effective. So we put this herbal tea blend together to let individuals know you need to make sure that your immune system is up to par. This is the time more than ever that you want to focus on your immune system, because this virus that is now flooding the country and not just the country but the world right now, it has nothing to do if you're small or big, if you're black or white, if you're young or old. It all has to do with the conditions of your body. Let me repeat that. It has to do with the condition of your body, because there's individuals that may catch the virus, not have symptoms, but they can still pass it. So you may not even have symptoms with it. But in all actuality, which common sense to me, a person that's dealing with that means that their immune system is probably up to par. And their immune system would not allow them to have the effects with individuals that are having more severe concerns. So if your immune system is up, your body knows how to fight and protect itself. One thing that we teach you here is the body is made to heal itself. We as people have to learn how to put the body in a position to do that. And how you do that is learning the different foods and the different minerals intake that we need to make sure that we have in our body.
So I'm about to go to you with the question I asked by Dr. Kamma. Do we need to focus on the medicine cabinet or the vitamin cabinet?
Okay, and that's a good question for me as well. The body is made of 102 minerals. You want to put in the body what the body is made of. The body is made of things like iron, zinc, silicon, selenium, magnesium, manganese, and things of that nature. So when it comes to food and or herbs, things that is made of the same things that the body is made of, that forces the body to go into a healing transition, which means that the body is more likely in an alkaline state. Once the body is in an alkaline state, which is your pH levels, there's no dis-ease that can survive in an alkaline environment.
Wow.
So you want to make sure that you're putting those things in the body to increase your alkalinity more than the acid levels in your body. If your body is full of acid, or if your pH levels is less than a 7.0, then that means your body is in a position to feed the mucus, to feed the viral, to feed infections, to feed the bacteria. Your body is in a state where it's going to feed the tumors and cancers and things that are festering in your body if it's in an acid state. But if your body is in an alkaline state, it's always healing itself. You'll have mucus coming up. You're always coughing. Your eyes may drain. That's because your body is always detoxing and always cleansing itself, because the body is made to heal itself. And how you know that to be factual, when you cut your finger, your skin goes back together on its own. If you break your bones, your cells will reignite itself to bring your bones back together. So we just all have to learn how to put the body in a position to heal itself, that no matter what comes our way, the body can proceed to heal itself.
So now, this is an internal substance. So we can't go pour this around the kitchen, pour this around the yard, put this out?
This is internal.
This is internal.
Right. Because regardless of what's going on the outside, whether it's clean or not, if your immune system is up to par and your body can fight, it will fight.
Okay, now